In medical school, often we learn about making sure that we're taking a complete history, making sure that we're not going to miss anything when we're talking to families. And in medical school, I know for myself, I didn't learn a whole lot about how to listen to the whole story.
I think the skills that we gain through the community pediatrics rotation actually help us to apply things that we learn from global communities and apply it to all of our patients.
I had a 17-month who came in who I was doing a weight check, and he had significantly lost even more weight. And in my younger days, I probably would have immediately started typing in for the Failure to Thrive labs. But instead, I first asked Mom, what do you actually have in your refrigerator? And you know, she had taken 2 different buses and arrived well over an hour late to her appointment. She had a box of spaghetti noodles and 2 frozen hamburger patties, and she wasn't getting paid for another week and a half.
One of the main goals we have for the community rotation is to really help residents experience the breadth of needs that children may have in our community. There are a lot of resources here in the Indianapolis community. However, the big important part is for pediatricians to have the knowledge about those organizations so that the families get connected to what they really need to support their child.
We have them visit La Plaza, which is an organization that serves the Latino community here locally in Indianapolis. We have them visit the Julian Center, which specifically helps serve families that are dealing with violence in the home. We also have them visit About Special Kids, which is an organization that serves children with special needs.
We are also providing an Indigo bus experience where residents will ride our public bus transportation system to Crooked Creek Food Pantry, where they will learn about Gleaners Food Bank services and other resources for food insecure families.
All of those go back to trying to link residents with organizations that serve special populations. Part of what we want to do in the community rotation is really help residents listen to the entire story.
I collaborate with other global health educators around the United States who are trying to help better prepare programs to integrate global health education into the heart of the residency curriculum so that it's not an add-on experience in residency, but it's actually threaded through their entire training experience. In addition to the opportunities I've had to work with the community pediatrics rotation, I've also had the opportunity to work nationally with the American Board of Pediatrics Global Health Education Task Force, and I've been able to work with other global health education leaders throughout the country to assist program directors into integrating global health education into the fabric of residency training.
I think learning about global health and participating in global health really helps us as pediatricians to advocate on a better level to give dignifying and honoring care to each and every patient that we see here in the United States. And I know personally I've learned a lot from being involved with global health on how to better advocate and better meet the patient's needs that I see here in an underserved community than I would have if I wasn't involved in global health.